Hey everybody, welcome to my channel. My name is Sharon Michelle, and you came across the page of Mom's Journey. And if you came across here by accident, welcome, welcome, welcome. If you are already a subscriber, I say thank you for coming back, and I ask you all to just continue liking it, sharing it, get others to subscribe to the channel, and hit the notification button so you'll know when I'm going to post another video. Today's video, I'm actually 13 days post-op tummy tuck surgery, Dr. Kagan from Jolie Plastic Surgery. And today's video, I'm going to just talk about the medications prior to and then what you should be taking after the fact as well. It's kind of like boring, so I'm not uploading every single day, but I'm in the recovery state, so I'm just kind of here and trying to figure out what to bring y'all. But also, before I do the medications, I want to also kind of give shout outs to some people, people that don't even know they're going to be shouted out. Before I decided to make a YouTube video, because y'all know I am very, very new, I kept trying to figure out how to get an intro, outro video. I heard all about the things you had to do. I got crazy pricing, like $500. I think the lowest I got was $200. Then I realized a cousin of mine does it and said $100, but I ran out of time before I was going to get my surgery. So what I decided to do was go on YouTube and kind of figure out how to do it on my own. So the intro and outro video that you see on my page, I did it myself. But I want to give mention to some people, because had I not watched their videos, I probably would not known how to do it. One in particular, Jamesia T. I'm looking down on the paper too. She taught how to make an intro, outro. When I tell you her step-by-step process was so simple, she made it so simple for me to follow, that now I could just go on and edit on my own. And another one was Pretty Tayta, T-A-Y-T-A, and her videos also. So I'm going to show you their links, and I want y'all to go on, subscribe to their channel, because they were extremely helpful in helping me to get my videos started. And like I said, I don't know these people, but it's people out there that really have good information out there, and it can help others. I want to put a shout out to Lanita Smith, and she had many different surgeries, and she let y'all all go on her journey. But I would say that she gives the overall best information. Everything I needed to know about my surgical procedure, she was there to give it, all the way up to the types of garments, exercise, everything. Her videos are so on point. Like I said, I'm going to put her link up, and I want y'all to like and follow her page as well. And then I have one that I just came across just the other day, and I was so inspired by her because my next surgery coming up is my thigh lift. That's the second part of getting skin removed after gastric bypass. And her name is Katrona, a.k.a. Kat. And she is a very bubbly person. She has a very intricate personality. And if you look at her videos, you would definitely like her as well. There's so many entertaining people and people on YouTube that have a lot to talk about. And my videos in particular are really out here to help other people. Like I always say, if this is something you don't like surgery, you don't like cosmetic surgery, you don't like elective surgeries, or, instead of hating on somebody else or saying negative things, just pass by this video and go, to something that you are interested in. Once I really get into my whole story and my journey, you'll understand that this was, my son is so loud. This was something that was on my mind for a very long time. And it's almost like it wasn't something that was cosmetic for me. It was something that was necessary. But, as I go on with my page, you'll get to know who I am and my struggle that I had with weight loss all my life, and how you have to be comfortable in your own skin. And, a lot of times we walk around and we pretend for people, and people don't know that we're hurting inside. So I will be telling my journey. And, but I wanted to shout these people out because, like I said, they have a lot going on their channels. And Kat, she is very, very talented. I mean, this girl sings. She has personalities that she will do. She does the crocheting. But one in particular, I was so impressed because I'm also a licensed cosmetologist. Is she does nail art. And when you see her nail art, I'm blown away with her page. So I want you to go and check out these people and give them a play and share their pages as well. So further ado, I'm going to now let me shout out some other people that definitely need a shout out. First, I want to talk about my mom. My mom, that's one of my road dogs. My mom, she think I'm still a little kid because it's almost like you ain't going away without me anyway, But I decided to get an Airbnb opposed to going to a recovery house or whatever. I wanted my family there with me because I knew I was going through an extensive surgery. So I took my mom. I took one of my best friends. I took my daughter. I took my son with me. I paid for everything because I knew they were there to help us, and it was cheaper to pay for airfare, to get the Airbnb, to get the car, and have them there to help us than it was to go into a recovery house because what a lot of people don't know is my daughter had an elective surgery as well. So if we both paid for a recovery house, it was ridiculous prices. So what I did is we got there early, 2 days early, because I had a pre-op the day before my surgery. So I got down there the day before that. And we went to Walmart, bought up all the groceries and everything as if we were home. But I just wanted to thank my mom because my mom was a trooper. I know how it is to jump into mommy mode. Because my mom was there, and I mean tripping over everybody because she was so helpful. She definitely, you know, didn't want you to walk around, didn't want you to move, didn't want you to, if she heard you cough, she would jump. I had to sleep on the couch after my surgery because I couldn't really lay down in the bed. And she slept on the other part of the couch with me. Like I was 2 years old. I love her to death. And I just thank her so much. She was really the nurturer. But when my daughter came home from surgery, I had tubes and everything else, but I jumped into mommy mode. So I understand how she felt because I didn't want my child to hurt at all. And you wouldn't even have thought I had surgery because I jumped right into mommy mode with my daughter. But like I said, she's a trooper. And my girlfriend Zoe. Anybody that knows Zopal knows she is so helpful. But when I tell you, I mean, that was our driver. That was our, that was the one that kept the house in order. She has OCD, so she pick up after everybody, making sure everything right. But when I tell you, it was so comical having her and my mom there because they were like Thelma and Louise, and them two, the fussing back and forth in such a jokeful way just kept us, um, it just kept our recovery, made it so nice. And I don't know a lot of people that will just jump up and go with you. You know, I said, I'm going away for 10 days to have surgery. You know, will you come with me, help take care of us, and, you know, be our driver and go pick up our medicines, go pick up whatever we need. You know, take me to my pre-op, take my daughter to my pre-op, take me to post-op, take my daughter to post-op, take us to the Faja place, take us to get food, take us to do whatever it is we needed to do. And she was a trooper. And I just, you know, I thank her so much. Um, just love her to death. Um, my son Jaden, yeah, I pulled him away to go with us, all women. I think he saw more in this 10 days than he ever could. But when I say he was so helpful, I mean, he's the one that had to help pull us up, had to put our compression socks on. I mean, he was just a trooper. And I know that, you know, we took him away from all his friends and everything else, and he was just there with us for 10 days, all women. I mean, we drove him crazy, but he was such a trooper. And I was, you know, I felt so much better having my child there with me. And my daughter, of course, you know, she had a surgery as well, but it was just really good to have all of my family members and my best friend around with me. I also want to send a shout out to my best friend, Darlene. Darlene Epps Minor. She's one of the twins, and both of my twins are the twins are best friends. But Dara is my prayer partner, and she always keeps me lifted up. She makes sure that she prayed for me before I, you know, got on the plane. Prayed for me when I got off the plane. Prayed for me before my surgery. Prayed for me after my surgery. You know, and I tell you, you need to have friends like that. You know, a lot of people don't know. I'm also an ordained minister, and I love my church, New Kingdom Baptist Church. My pastor is Daniel Jackson, so I'm shouting everybody out. And my pastor was so concerned about me, and he just kept saying, I'm so worried about you with this surgery. And I said, I'm going to be all right. And I don't know what he thought I was going out there to get. I guess he thought I was getting ready to go out there to get a big booty and be a video vixen. No, that's not what I was doing. And after I explained everything to him, he understood, and he prayed with me and prayed for me, kept checking in on me. So I just, you know, you got to say thank you to the people that you know are in your corner, and give them their props while they're here on earth. And last but not least, I want to thank my husband. Despite whatever we go through or whatever, he made it possible for me. You know, for Christmas, he said, what do you want? And I was joking. And I said, I want to start getting the skin removed. I want to get a tummy tuck. And he came through with the money. Despite how he felt, despite, you know, anything, you know, that he had in him of not really wanting to get it done and worrying about the procedure itself. And, you know, he still did it because that's what I wanted. So I thank him as well. So, as I said, I wanted to put this video out there to just thank everybody. And, I have a lot of videos coming. And, because actually I still have one tube in, and I'm going to be taking that out. And I'm going to do that with y'all as well. My doctor told me how to remove my own drainage tube, and I'm going to do it with you. And once I remove the drainage tube, then I'll be able to get into my other garment, and you'll really be able to start to see the transformation. But what I always want to say is I want my videos to be informational. People that are just like me, that have these issues on the inside, think it's not possible. There's ways of getting the money if you don't have money. I just want to put all the information out there, and let you know that it's possible. You know, we see people on TV do these types of things, and, you know, and think that it's not possible. And it truly is possible. So, you know, I just hope that my journey will eventually help somebody else. If it just helps one person, then my ministry still goes on. Because no matter what I do, I make a ministry out of it, because I know that my ministry starts off with helping, being a servant and helping people. And you'd be surprised how the things that we do in life help somebody else. And so I have so many things coming down the pipe that I'm going to be letting y'all know about. I'm going to be tag teaming up with somebody that I call my sister daughter, because she's like a sister to me, but she's young enough to be my daughter, and we just gel together. And she has a spilling the tea, with Lady T on Facebook, and I have my YouTube, and we're going to collaborate together and bring you some Q&A, some informational. So y'all just stay tuned, okay? And I'm still coming to y'all about the medications. All right, so let's get started on the meds. Now, understand that all doctors, they may have a slightly different list or whatever, but for the most part, it's almost the same no matter where you go. The minute you prepare yourself and say, you know what, I know I want to have surgery of any sort or whatever, you need to get your body prepared for it. People think that some of the cosmetic work that they get done and stuff is for the mere purpose of weight loss or whatever. But at the end of the day, you have to be healthy in order to have surgery. If you're not healthy, they will not allow you to have surgery, because you have to go under anesthesia and everything else. And so basically they make sure that you are at your tip-top number one, that your body is at peak performance before you're allowed to have surgery. So like I said, when you know that you're going to do it and you're calling around, there's certain supplements and stuff that you should be taking off the bat. So I take 1,000 milligrams of vitamin C. You need to take that every single day. Also, you want to get yourself a multivitamin, okay? A multivitamin, and you want to take that every day. They want to make sure, number one, the biggest thing is your hemoglobin, to make sure that your hemoglobin is at the highest that it could possibly be, because a lot of the doctors want hemoglobin to be like 11 point something, 12, 13, 14. I'm anemic, so I already knew to prepare myself. And so what I did, I actually set myself up to get iron infusions, because I knew that my iron is always low. So at the end of the day, you're going to have to take iron, folic acid. A lot of doctors tell you to take the Hemoplex, okay? Now, those are things that you need to be taken beforehand and get yourself geared up and prepared for your surgery. Now, a lot of the doctors would tell you 30 days prior to surgery, cut herbal substances. My doctor actually wanted me to cut my vitamins as well. Like, I was only able to take, I think it was, I could still take the vitamin C, and that was it. They told me to get off the folic acid and everything. I told you I got an iron infusion or whatever. So those are things that, oh, and also understand you're going to have to get off, if you're on birth control, you got to get off the birth control. If you smoke, you better stop smoking as soon as you know that you want to get surgery. That is a telltale. They will not give you surgery with nicotine in your system. It will kill your blood vessels and everything. Like, they will not do it. A lot of them don't want the marijuana either. So be careful. Check with your doctor and know. I know some girls were saying like they had stopped smoking for like 8 weeks or whatever, and it was still in their system, and they had to reschedule. So make sure that you cut it all out. They want you to stop drinking. They want you to be at your tip-top peak performance before having surgery. So I'm telling y'all because this is like one of the number one reasons that your surgeries can be canceled. Now, when they'll tell you, they'll also give you stool softeners. They'll tell you after your surgery. So when you come out, the same herbal substances and stuff that you were taking, you need to keep taking. So, you know, this is after surgery. So as soon as you have your surgery, now you're going back to keeping your body healthy and keeping all the vitamins and nutrients in there. Now, they'll give you a stool softener because, baby, I'm telling you, I know number one with the tummy tuck, when you're talking about having to make that first bowel movement and you done had muscle repair and you have stitches from hip to hip, you have drainage tubes and everything, you can end up in a hospital. You can end up feeling like you're going to be 6 feet under. So they'll tell you to start taking your stool softener right away. Now, this is what I subscribe to, Mango 7. It's a probiotic. And these are not hard on your digestive system at all. When I used to go get colonics and all, this is what I would buy from the place. And you can literally take this every single day. And it's not like your body will get into a habit form and depend on it or anything like that. When I tell you, and not to be too gross, but we're talking real talk, you know when it's time, when you're finally ready to go. There's no effort, no strain, no nothing. Mango 7. I don't know about them stool softeners. I know when I used to try to use them years ago, whatever, that was a messy, messy situation, okay? But Mango 7 is a cleaner situation, milder situation. It's not habit forming. And I did these the day when I came out of surgery. I started taking them every single day. And I still take them, and I'm 13 days post-op because I'm not nowhere near healed. I'm only 13 days post-op. I still have my stitches from hip to hip. I still have my drains in, and I still have a muscle repair. So I have stitches on the inside, literally from here all the way down under my belly button, where they have stitched my muscles back together. So technically, y'all, under all this, I got a 6-pack going on, okay? I just got to get the definition when it's time for me to get into the gym. So you definitely want to take that. They're gonna after surgery and you are in pain, number one, they're going to give you a pain pill. They're going to give you an antibiotic. And they're going to give you Zofran or something else for nausea. Now, I didn't need none of the nausea medicine at all. The antibiotics you take. Now, I always, any doctor that prescribes me antibiotics, I always ask them to give me something for a yeast infection, just in case, because a lot of times your antibiotics will give you a yeast infection, but didn't have that issue. But I got it just to be on the safe side. So that's something that you might want to think about. But the Zofran is, you know, they'll give you, it'll come like this. It's a little thing put under your tongue in case you get nauseated. Now, my suggestion to you would be take your pain meds with you. Because, baby, number one, they give you your script and you're already out of surgery. And who's ever taking care of you has to go to the, you know, whatever pharmacy that they can go to get your script filled. In a lot of cases, they're out of them. They don't have them. They got to go to several different stores. And you home feeling like you getting ready to meet your maker because you don't have pain pills. Now, understand. I am not telling nobody what to do. I'm telling you what I did, okay? And I have a pain management doctor because I have arthritis in my hip. And I let my pain management doctor manage my pain and give me my medicine before I got to Miami because I wasn't waiting on nobody. And let me tell you something. My doctor said, I don't care if you feel it or you don't. Every 4 to 6 hours, take your medicine. Stay above your pain. I've looked at so many videos where these girls is crying and on the floor. And listen, I was not going through that. First of all, I'm too old for that. Number two, why? Listen, I'm sorry, but I'm not worried about getting hooked on no medication and all that. If I get hooked, then I'm going to go into rehab. But right now, while I'm dealing with this surgery, this is what I'm dealing with right now. And at the time, I'm taking my meds. And my daughter had a BBL. She had an elective surgery, something she wanted to get done. And I already knew that when they come out of surgery, their thigh is filled with the tenestrin or whatever they call that fluid. It looks like they got blood all over them. The girls is crying. The girls can't move. The girls is screaming. And listen, I already said when my daughter comes out, I want you to put this in her mouth. When she came to the Airbnb, I put something else in her mouth. We never experienced the true pain that a tummy tuck or a BBL or whatever, lipo, we never experienced what the real pain would be. I don't know what the real pain would be. But they'll tell you everybody prescribes to Tylenol. I can't take Tylenol, okay, because of other medical reasons. I can't take Tylenol. I can't take NSAIDs. I can't take muscle relaxers because of the different surgeries I had, the gastric bypass and different things like that. If y'all had that, then you know that you can't take NSAIDs of any sort. You can't take your ibuprofens and things like that. So unfortunately, I have no choice but to be under a doctor's care to manage my pain. But everyone that that you hear about after the first couple of days, this is like your best friend. It helps with the inflammation and everything else. So your Tylenol would be good for that. Now, it's hard to sleep after surgery. I have insomnia anyway, but the Tylenol PM is another one of your best friends. Now, I am just somebody different. I don't know why things are just different with me because the Tylenol PM didn't put me to sleep. It did relax me, but it didn't put me to sleep. But for most people, they say Tylenol PM, and it'll help you sleep through the night, help you sleep through the pain. And this is something else that the Arnica tablets. Now, the Arnica tablets it relieves bruising, muscle soreness. So this is similar to a muscle relaxer, and it does help from the inside out. Now, I'm not talking about the creams or the outer stuff right now because they do have the Arnica creams and the gels and all that kind of stuff. But I'm talking about the internal medicines that you have to take. And this is also something good. Now, things that you don't hear and that people don't tell you about. Gas pains. Gas pains is like the devil, okay? From anesthesia, that gas will be caught up in your shoulder, in your stomach, in your back. Get some Gas X to make sure you have that around. And, I mean, you'll thank me later, but please make sure you pack some Gas X because you are definitely going to need it. Those are the basic oral medications and stuff that you normally will take for your surgery before I told you. And then after, there's other, you go back to your supplements. Now, I want to also tell you that they're going to tell you 30 days before your surgery. I know my doctor told me I had to stop all herbal substances. Like if you're taking Goli, gummies, the apple cider vinegar gummies or whatever, stop that. They told me no tea of any sort. I'm a tea drinker. I love tea. I had to stop the green tea. I had to stop the diet peach Snapple iced tea. I couldn't use my little flavor packs that I put in my water. I couldn't do none of that. They said stop all teas and all. And these are for reasons because certain medications and herbal substances will cause bleeding during surgery. Some things will slow up the healing process during surgery. Just understand that what the doctor says to you to follow those directions. It doesn't matter if grandma told you, well, it worked for her this way or that way or whatever. Follow the instructions. A lot of times people complain about their after results and stuff like that. And really it's their fault for not following instructions. So that was my take on the oral substances that you would take before and the pain meds and stuff that you would take after. I'm going to come back with another video, and that's going to be about the aftercare, the gels, the creams, and things like that that you would use for your particular type of surgery. I'm going to give you a packing list of every single thing that I packed in order to go to have surgery. And then I'm going to show you a lot of things that I didn't even use. So I'm trying to give you this list to help you out, and, you know, and not do what I did and run out and buy every single thing under the sun and then find out that a lot of the stuff you don't even need. So I hope that this helped you out. Once again, I want you to like, share, subscribe to my channel. Share it with everybody because, like I said, there's a lot of things that's going to be coming up. Just tell all of your friends to get on my page and push the notification button so that you will know when I post another video. I will be soon showing you my incisions. I'm going to show you when I take out my drain. I'm going to show you my before and my after results. I know some of y'all saw the massages and stuff, but I'm talking about when it really starts to get to some real results. I want y'all to all be there to witness this with me. And then I am in preparation for my thigh lift. I don't know if they're going to do the inner thigh lift or meteor. It's so many different types, but I have to find out which one they're going to do. I would have had it all done together, but as I said, they didn't send down my new blood levels, so my doctor wanted to be safe than sorry. But I'm kind of glad I didn't because, you know, I got through this like a champ, and still getting through it because day by day, honestly, the more you heal, the more you hurt because now I'm stiff. I wake up and, you know, I'm tighter. And, you know, now that it's tighter, now I'm walking. When they say you walk bent over, I didn't do that. A lot of things that they said to expect, it didn't happen with me. But now as I'm healing, I'm starting to have to take it a little more easy because I feel a lot of pressure. Honestly, y'all, after a tummy tuck, I feel like I have contractions. I feel fluttering, like when you have a baby and you feel that fluttering. This is so weird. After all these years, I feel like I'm actually pregnant again. That's what the tummy tuck feels like. Sometimes you get a little burning sensation in your incisions. But a lot of it is the nerve endings that's trying to fire off. It's the muscles that are getting itself back together. It's really weird. But through it all, I would do it again. You don't have to be in a whole bunch of excruciating pain. Like I say, you do what's good for you and be comfortable in the skin that you're in. And there's no reason to suffer in silence, basically. You know, if it's something you don't like about yourself, then you fix it. Bottom line. And also, after your surgery, eat well. Don't spend all this money to have these procedures done to then turn around and mess it up by eating all kinds of greasy foods and all. But that's another conversation for another time because I'm going to eventually show you some of my keto menus and things like that that got me started on the weight loss before, because I had to lose weight before I even had the surgery. And the keto diet was great for me. It might not be for everybody, but it was great for me. So I'm going to be sharing those things. But like I said, when you spend that kind of money to fix what you know that is broken, you don't want to jack it up, okay? And for all my holy rollies and all, because I am an ordained minister, that want to preach to the choir and say, you should be happy with what God gave you. Well, God did not give me this. God didn't give me all of this. I jacked it up. And so I'm fixing it up. Bottom line. All right. But once again, I want to thank you for being a part of my journey. Once again, like, share, subscribe, hit that notification button. And until next time, my journey is your journey. Let us all journey together.